It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Folks, and thank you for joining me on The Sam Lesante Show. Today, folks, we're going to be talking about the Lehigh Valley Physician Surgery the physician group at the Health and Wellness Center. Before I go to the two good doctors, remember, folks, you could download our app at SSP TV. And you can watch our shows anywhere in the world. You go to your Google search or your App Store and download us. It's SSP TV, and you can watch all the health shows. Now, let me welcome two doctors here. Dr. Mike Mahoney, he's been on the show before. Remember, Doc? Remember, I couldn't shut you up. You kept talking all the time. I'll tell you. And Dr. Jayme Lieberman, who's the first time on the Sam Lesante Show. Well, welcome to the show. Thank you. I always get a thrill at these shows because I always learn something, okay? It's amazing how the Lehigh Valley Health Network keeps growing and expanding in all the areas, you know? So it's always a thrill for me to have new people coming on or people who've been on just to bring us an update. Now, let me start with Dr. Lieberman. Doctor, for those people who do not know you, give me a little bit of your background.
Well, at Cedar Crest, I am a general and trauma surgeon. And I practice, clinically there. And in August of last year, I was asked to come up here to Hazleton to help the integration of the surgery center and the network into Lehigh Valley Hospital at Hazleton. So we've been working for the last 10 months or so to facilitate integration of Lehigh Valley Health Network into Hazleton.
So what did you bring to the table?
Well, the network has lots of resources and a lot of experiences in the past to be able to provide quality care for patients, and I provide a bridge to those resources and to those people. So we are in the process of standardizing processes to be able to provide patients in the Hazleton area the same quality of care that they should expect if they were to go down to Hazleton.
Allentown,
to Allentown,
yeah.
Correct.
So that's the intriguing part, because as we're doing these shows, and we're mentioning the tribe, this whole network, that there are many, like you get one opinion if you have a concern, you have many other doctors that you're able to, confer with, okay? And I'm sure this is the same setup up here in Hazleton, correct?
Absolutely. Their goal is to be able to provide patients from the Hazleton area with the same quality of service, surgical, oncology, pediatrics, any type of service that they would expect in Allentown. We partner at Allentown. We partner with several different groups, including Memorial Sloan Kettering for oncology, and by way of Allentown, the patients in Hazleton area are able to have that same connection to Memorial Sloan Kettering, and we would never have that without for the network.
That's fantastic. What specific, you're the director of surgery now, right? Okay. So what specific cases would it be? Because I'm sure most of the cases you don't have to just confer with other doctors, but what would be some of the extreme cases where you would be conferring with?
Well, it's on an individual basis. There's a lot of cancer patients who we would use those resources. And a lot of more complex cases with that involve the stomach or liver or so forth and so on. Or if there's complicated medical issues in a patient who has a surgical problem, we could use the same resources.
Mm-hmm. So you use telemedicine as well?
We are in the process of using
telemedicine. That's amazing.
The network uses telemedicine at Hazleton for strokes, for neurology, for burn. We don't have it quite in surgery, but it's on the horizon.
And I just think it's just phenomenal, really, for the patients coming in and the health care that we have here is good. Now, where are you originally from?
New Jersey.
Oh, yeah? So what made you come up to the Lehigh Valley Network?
Well, after medical school, I did my residency at Lehigh Valley Network in Allentown, and I love the area, and it's a great hospital to work for. It's a great organization to work for, and here I am.
You're doing, from what I understand, you're doing a fabulous job, along with Dr. Mahoney, and you also have Dr. Walco there, right? He was on the show originally. So you have three surgeons, okay, up at the Lehigh Valley Health Network, Health and Wellness Center. And my good friend, Dr. Mahoney, how you been?
I've been okay, thanks.
You've been busy?
I've been getting busy, yeah.
Yeah? I was somewhere when you were on the show last time. Okay, you had a patient. Well, many patients, but anyway, my wife and I are shopping someplace, and this lady comes running up to me, and she says, "I'm so happy you interviewed Dr. Mahoney. He's such a nice guy. He was so good to me." And when I said, "Well, that's good." I said, and she couldn't stop bragging about you. I thought it was very nice.
I appreciate the compliments.
Yeah.
Thank you.
You know, bedside manners is always a concern. You know, sometimes you guys are really busy, and they sometimes, you have to. Patient's nervous the way it is, etc. What you been up to? Anything?
As far as
surgeries?
Yeah, I've just been staying busy doing the normal general surgery stuff. I see patients both in the office and at the hospital. Whether I'm on call at the hospital, if you come into the emergency room with something, I'll see you there. And like you said, it's a tough situation to be in. You have to almost immediately form a bond with somebody to have them trust you to operate on them. So yeah, bedside manner is incredibly important.
Yeah. Now, what are some of the common conditions that what are some of the common conditions you see in your practice?
So in the office, I'll see a lot of gallbladder disease, stones, abnormal gallbladder function. I also see a significant amount of hernias, both in the groin and the abdominal wall. And just a lot of other things like skin lesions, little masses that people are concerned about, those sort of things. I also do a lot of, or I'm trying to focus on doing more colorectal stuff. So if somebody finds a lesion like on your colonoscopy, we can talk about getting you a resection or something like that. On the hospital side, I see a lot of your regular general surgery stuff, appendectomies or appendicitis, bowel obstructions, diverticulitis, that sort of stuff.
How long have you been practicing, Doc?
I've been practicing for almost 2 years now here. Yeah. This winter will be 2 years.
And where'd you come from?
So again, I grew up in the Midwest, Green Bay, so I'm a Packer fan, and I catch a lot of heat for that.
I'm sorry to hear that, but that's okay.
But then I actually did my residency in the suburbs of Philadelphia, and I actually did rotate through Lehigh Valley in Allentown for some of my rotations because I was at a small hospital, not unlike Hazleton here, which is one of the reasons I came, and got a good education, I think, through that whole network.
Now, I know you said you do a lot of different surgeries, and I want to ask what are some of what particular interests do you have? What areas of interest do you have?
For me, I really like the minimally invasive surgery, so like laparoscopic robotic surgery. I think it's incredibly cool that we can do these major surgeries through little tiny holes now. And so a lot of the surgeries that I can do that way, like your gallbladder, your appendix, your colon resection, those are the cases that really interest me because people are incredibly grateful when they're done. They have less pain than the old traditional approach, and they don't feel like they had major surgery. So I find that incredibly rewarding, and those are my favorite things to do.
How about you, Dr. Lieberman?
Well, at Hazleton, I personally focus more on ambulatory surgery, meaning that you go home the same day, like hernia repair and skin lesions and so forth. The practice, like Mike said, like Dr. Mahoney said, I think is we have a wide range of patient disease processes that we take care of.
The surgery group now at the Health and Wellness Center, as you said, reaches out to many other doctors if you need the consultation. What do you think would be the? I want to ask you a question before I ask you the advantages. What made you become a doctor?
Well, I've always the short story is that I really enjoyed being faced with immediate problems and the ability to immediately solve those problems, and I enjoy helping people. And putting those two things together is, particularly with emergency surgery, you really don't have much time to think about what the alternatives are. You just have to take care of the problem, and people are very satisfied with the outcomes.
Did you decide when you were in high school or grade school or college?
Yeah, high school into college.
Yeah.
Yeah.
And so you decided, now why surgery?
For those reasons, I like to walk out of the room knowing that the problem is fixed.
How about you, Mike?
A lot of the same things. I think you'll find that common amongst a lot of surgeons is that you get to diagnose and treat somebody, and it's on a relatively quick basis, sometimes even emergently within seconds you have to figure out something. And not only just the satisfaction of that, but the challenge of that mental process of keeping control of the situation and just going back to what you know and helping somebody. And then also I like working with my hands. I do a lot of like woodworking and stuff like that on the side in my free time when I sometimes get that. But those are the main reasons I became a surgeon as well.
The thing that always fascinates me is how you guys, and women too, doctors, how you stay calm when there's a major emergency happening. I mean, it's just like, you know, they take a calm pill, or I mean, it doesn't come natural, because of course the people are coming in, either their spouses or their kids, or I mean, they're a wreck. And you guys have to be, and women have to be tuned in on what you do. I guess that's where the training comes in. Is that how do you stay calm, Mike?
I think that's a good point. That's the training, because when you start out training, you might look calm, but on the inside you're
a wreck.
And after you see situations and you're around your trainers that have been through it already, you can then kind of relax and just fall back. They call it fall back on the training. You just kind of take a breath for a second and go, wait, I've seen this before and this is what we did.
Okay.
And then you can just
So you have to
fall
calm the
back on
people down, right, who are coming in. I mean, especially if it's a loved one or whatever. You have
Oftentimes, yeah.
Yeah, and you have to, and how do you do that, Jayme?
Well, that's actually part of the allure of the job, is that we don't just take care of the patient, we take care of the patient's families, right? So in particular situations like that, if we lost our cool, nobody would be happy. So it's, you know, the staff, the patient, the family, you know, the whole team.
And there's another thing, the team. You know, how do I'm sure you have a good team that you have to work with, correct,
Yeah.
Jayme? And the training now, do you, so if someone would ask you, okay, what should we look for in a good surgical doctor? What should, why should I have you operate on me or you operate on me? What should you look for? Let me start with you, Jayme.
Well, I think there's several things. The most important thing is quality outcomes. I think that as you become more ingrained in the community, the people, the community itself and the providers, the primary care physicians, will know that we provide quality outcomes. And like I was referring to earlier, the network at Allentown provides quality outcomes. And we want to make sure that the community knows, and the primary care providers in the community know, that those same quality outcomes are going to be expected at Hazelton. And I think that's the most important thing. If we can't provide quality care for patients, then, you know.
And so what will you be looking for in a surgeon, Mike?
Again, I think those are your big looking points, like Jay said, was quality outcomes. Look at somebody's record, look at that. And then the other thing is, what do you think of the person? What's your first impression? You know, not every patient that I see that walks through thinks that I have, just a personality thing. So if you're not sure, get that second opinion or third opinion or whatever you want. So that's kind of the main things I'd be looking for is one, do they have good outcomes? Do they do this surgery regularly? Do they focus on this? Mm-hmm. And then the other thing is, do you trust that person? And because it goes the other way.
You got to build that trust.
You have to build it, and,
Yeah.
and it goes the other way too. Like there's patients that some doctors will go, something's not right with this patient. You try to figure it out and work through it, but those are kind of the big things that you look for.
And the judgment here was when that lady made it her duty to run over to me and my wife, okay, specifically to tell me how thrilled she was to see you on the show and how good you were to her, I mean, I think that's a tribute. It really is. She could have said, "Hi, Sam, I saw Dr. Lieberman," but she was I figured she's coming to see me because I'm so handsome, but no, she wanted to tell me how great you were. So, but I think that was very nice.
I appreciate the comments, and word of mouth is almost
Yes.
any doctor's best advertising.
Yeah.
So it's,
Well, first, if you're new in the area, they're always, you'll have doctors been here for a zillion years, but then you're new. What kind of guy is he? What kind of girl is she? Does she know this? He looks young. Does he know what the hell? There's always, does this guy really know what he's doing? He looks like a kid, These are kind of things in word of mouth until you start building that trust up, And hopefully shows like this introduce you to the people. Folks, I'm talking to Doctors Mahoney and Dr. Lieberman. They're from the Lehigh Valley Physician Group in the Health and Wellness Center. Now, to ask any questions, we're going to come and we're back. We'll talk a little bit about what are some of the latest advancements in surgery. We touched a little bit on that, but it's a very easy number, 570-5014, the number 4, LVH. We'll be back right after this. Welcome back to the Sam Lesante Show. Remember, 24/7, you can watch all of our programs on SSP TV. And folks, for you watching us here in the Greater Hazleton area on Service Electric Cablevision, remember HD as well, 513, and download our app. You don't have you want to see the show? Just download our app at SSP TV, and you can watch all of the shows we produce. Today I have Doctors Mahoney and Lieberman on the show. They're from the Lehigh Valley Physician Group up in the Health and Wellness Center. And Dr. Lieberman, now Dr. Walko was on the show. Tell me a little bit about Dr. Walko.
Well, Dr. Walko is also fairly new to the community. He's been here for 6 months or so. He is a fellowship-trained bariatric surgeon, essentially a weight loss surgeon and a minimally invasive surgeon. So he is in the process of building a practice. He's done bariatric cases at Hazleton Hospital, and the outcomes are good. So if there's any patients or providers in the greater Hazleton area who think that a weight loss surgery would help them from a health standpoint, Dr. Walko is certainly willing to treat them.
Now that bariatric surgery has really developed over the years, and the way the approaches. I mean, when I say the old time, 10 years ago, whatever. There's such a different in procedures now. Is that correct?
That's correct.
Yeah.
Dr. Walko actually does minimally invasive bariatric surgery, so he makes several small incisions, and the patient goes home in 2-3 days. And it's becoming more and more popular because we've identified that not only does the patient lose weight, but they get healthier. Their diabetes are cured, and it's really a great procedure.
So what is the rule of thumb here? Do you have to be 50 pounds overweight or 100 pounds? I mean, what is the rule of thumb for getting the bariatric surgery?
It depends upon what medical issues you have associated with your weight. The best way to see if you qualify is to look for our free information sessions, and Dr. Walko leads those intermittently throughout the area, in Schuylkill, down here in Hazleton, Wilkes-Barre, and Berwick. So he'll be having some information sessions that we'll advertise, and if you have any questions about it, just show up.
Is there any way, I know he has the sessions, but let's assume someone's watching this and they know they're overweight. I mean, they want to do something about it. They've tried diets, they tried everything possible. Okay, can they call the wellness center and could they get information?
Yes.
Okay, so folks, if you are concerned about that, I would highly recommend it. It's 501-4-LVH, and just ask for Dr. Walko's office and get the information, because sometimes people, it's a learning process again.
Sure.
I think you have to go through some various tests and make sure that everything is appropriate with that. Dr. Mahoney, in your field, what are some of the latest advancements in surgery?
I think the biggest advancements, again, that affect me personally in my practice are going to be your advancements in the minimally invasive surgery that we sort of touched on earlier. Just the technology itself gets better and better. Well, we might be doing the same procedures in a similar fashion. There's new instruments that come out. There's better technology with the cameras for visualization. Trying to get the boss to sign off on some new stuff here. And then also robotics, which is another thing. Hopefully the place will build up too, which is just another advancement. But there's constant influx from the industry on different products to use and new products to use that just make old surgeries that were good even better.
Now, do you do robotic surgery?
I was trained in it, but we don't currently have one here right now.
Come on. We need it
We're
here.
working on it.
Come on, let's get on the ball here.
It's in the conversation.
Yeah, come on. I mean,
We hope to have a robot.
well, you have everything else. I mean, the advances. I mean, in surgeries. I mean, it's like these phones. It's a 5, then it's an 8, then it's a 10. I mean, I guess it's the same thing in surgery, right? Advances in technology.
Yeah, absolutely. Like you said, it does a lot of the same things, but it can do it better, faster, more clearly. It's just so it's really expanding what we can do in the OR and helping make cases quicker, get people home quicker.
Yeah. With the advances we have today in medicine and surgeries, is just, there's no reason for people to be out there suffering with any kind of pain or whatever. Just get in there and get your checks. In terms of your team, okay, I touched on this before, but I know good friends of mine who are doctors, okay, they swear by their team, okay? They have a team that actually the person knows exactly what Mike's going to do before he does it. I mean, so you guys have your own teams, your surgical teams?
Yep. Yeah.
And they're all trained?
Yeah, we actually have multiple teams if you think about it too. Like I'll have a team at my office. It's the same group of people that work with me in the office, and everybody has different tasks because no doctor can do their job by themselves. It takes a team to get the job accomplished. So I have that team, and they function well of getting patients their medications, getting them scheduled for follow-ups, getting them scheduled for surgery, and then over at the hospital, after you work with some of the different teams for a while, they're the assistants, the anesthesia team. Everybody kind of gets to know the routines, and it helps make everything go a lot smoother.
In dealing with the patient, okay, and this is always a concern, when the doctor comes in and talks to him, and then as the patient's progressing, then you may send an assistant in, okay, just to check on Mr. Lesante, all right? So then that person says, whoa, wait, I want to talk to the doctor, okay? They should be comfortable with that person coming in, or you wouldn't send that person. Am I correct in saying that?
Correct.
Mm-hmm. Yeah, because I guess, I want to see Mahoney. Okay, I want to see him, and that happens. But word of mouth, as you said, Dr. Lieberman, is so very important. Many years ago, from day one we started my program here, I was always a supporter of local doctors, nurses in the medical system here, even before Lehigh Valley came, because I know a lot of the doctors, and they're, sometimes we'll go to Philadelphia. Well, you were in Philadelphia, and sometimes you go to Philadelphia, you get interns, you don't even get the experience that you get up here. Am I correct in saying that?
Yeah, I think at any teaching institution you'll have a little bit different experience. In this day and age, I think that's gone, where it's just an intern or a resident taking care of you. I think there's a lot more responsibility that the attendings have, and you should get some face time with that. But yeah, up here we don't have that whole entire team like that, so you will get a little more doctor face time and more regularly.
How do you see medicine in the next, I can't even say 5 years because it changes so fast. How do you see things happening in the medical surgical areas in the next 2 years?
Well, I think that there's a nationwide change to provide better quality care for patients and access. And that's what our goal is here at Hazleton with the support of the network. I think that patients need, when they make a phone call, they need to be seen in a reasonable manner, and they should expect quality care. And I think that the government actually understands that too. So quality is important.
That's good. So why would you tell someone, okay, why they do not have, other than brain surgery or something that's, a major heart, of course, Lehigh Valley is a great heart team. Why would you tell people there's no reason to leave this area when we have, we have great doctors here? What would you say to them, Mike? You've been here for a couple of years, haven't you?
I think the first step is just come see us. If there's something that we're not comfortable doing, that's when we can get you out to the appropriate, like Jay said, we can network within the network, and then find you the appropriate patient. Occasionally somebody comes in with something that I don't take care of, and instead of put that patient at risk or a risk for a bad outcome, I'll send it to somebody that does that sort of thing.
See, I think people think that you guys don't do that, or women don't do that, because they think sometimes, well, maybe he'll get offended or she'll get offended. I don't think that's the case at all. Well, he won't send me to somebody else because he wants to do it. I don't think that's the case. Am I correct in saying that, Jayme?
That's the case. I reiterated, our goal is to provide quality care. We like to think that we provide quality care here. There are cases that we don't do here, open heart surgery, brain surgery. When we find these cases that need to be done, we get them to the right people. The ultimate goal is for the patient to be comfortable and to have quality care. And we provide that for the majority of cases.
Yeah, getting out into the communities, a show like this, a vehicle where people could hear the doctors and know that they're just as human as they are. Okay, are you married, Doctor?
I am, yes.
Any children?
I have a couple of stepkids, yeah.
Yeah, how about, that's right. They're getting older since I talked.
They are getting older.
Yeah, thank God for that. Are you married?
Yes, I am.
You have any children?
Yes.
Yeah. And do you live in the area here?
I actually live down closer to Allentown.
So you commute every day?
Sure.
Yeah. It's a lot of doctors are going back and forth from Allentown here. Yeah.
That's good. It's a nice drive.
Yeah. Well, maybe you'll come back or maybe you'll come and live in the area. It's a great area.
Sure is.
It's always nice to educate our viewers as to what's available in the health field today. But I think you check out your backgrounds and what you guys have done and women have done, and it's phenomenal. Really, it really is, and especially the network, the way it's set up. I just think it's fabulous. I mean, I know Dr. Evans and his group over there. I mean, he has access. When you say Sloan Kettering, I mean, he has access to everything. And the same thing that you have. The network is there. Folks, if you want any information whatsoever about the wonderful doctors we have, just call 501-4LVH. It's 570. They're from the Lehigh Valley Physicians Group. And there's Dr. Mahoney, there's Dr. Lieberman, and Dr. Walco. I play the show a couple times with Dr. Walco, and you know how great he is. Now remember, if you go to download our app, you can watch all of these shows. If you want to see Dr. Walco's show, you just hit the Sam Lesante and scroll down, and you'll see Walco. And these gentlemen will be on our app, so you can watch this anywhere, any place in the world. And remember, 24/7 SSPTV.com. Doctors, thanks for coming on the show. Good luck to both of you, and I wish you the best. Keep up the good work. We'll see you next time.